Welcome to The Consult Before the Cut, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. I'm Dr. Jonathan Weiler, a board-certified plastic surgeon with over 15 years of experience.
I am Taylor Besh, physician's assistant and expert injector at Weiler Plastic Surgery.
And I'm Brittany DeSherry, nurse and COO over at Rejuvime Medical. Each week, we'll dive deep into the latest trends, expert insights, and real stories from the world of beauty and wellness. So grab a seat at the consult room and let's discover the secrets of timeless beauty together. Hey everyone, welcome back to the Consult Before the Cut. We have such a fun topic today. We're going to get into it, obviously. It's about the lips. It's about the lips today. Before we get into that,
It's coming up Valentine's Day.
I know everybody got to get them lips ready for some smooching. Okay, before we get started, we want to thank Rejuvime Medical, one of the biggest, I always like to.
Largest Louisiana, certainly.
Biggest in Louisiana for surezies. We now have 12 locations across Louisiana and one in Mississippi for all of your age-defying needs to get us back to that youth that we long for with HRT, which is hormone replacement therapy, all of your GLP-1 therapies, peptides, aesthetic injectables, all of our lovely nurse practitioners to help go along this journey with y'all. We always like to thank them. And of course, the one and only Weiler Plastic Surgery Group, the largest plastic surgery group in Louisiana with 5 board-certified plastic surgeons. Amazing group of aesthetic injectors. And we also have estheticians that make you luminous.
Luminosity.
Luminous. We learned a new word today, and it's luminosity that we will be using. But Weiler Plastic Surgery there is to make you feel luminous and radiant and beautiful and all the things that you are looking for. So we always want to thank them for allowing us to do this.
Truly.
Okay, wait. I have to tell y'all. Wait, I can't believe I haven't told y'all this. So last night, my oldest daughter, first reconciliation for all you Catholics out there. This is the first time that the littles go to confess their sins. And it was the cutest, funniest thing.
This was last night.
It was last night.
Really?
Yeah, it was last night. I was
so
like,
sweet.
what are your sins? And she's like, I don't have to tell you. And I was like, okay, that's true. But like, what is your sin? Like, what are you confessing? And she's like, I don't have to tell you.
Oh,
she's like, I don't have to tell. And they got their little candle. She was so sweet.
So precious.
All those little second graders and like what their sins are. Like, it's fantastic.
So sweet.
I didn't ask such and such to play with me in Foursquare on the playground. I'm like,
wait, what happened with a dog in y'all's fountain last week?
Okay, so this is actually, they live down the street from us. I know this dog. I know this dog. So at our church and school, we have this big fountain area, and it's almost like a pool, basically.
It's huge.
It's huge, and it's like this pool thing. Well, a family who lives down the street from the church and school, we all live in the neighborhood, their dog had gotten out and was just in the fountain at the church, just playing. It's like it's like a spaniel dog, and just in there, just playing in the fountain. And they took a video, and they were like, "Does anybody know whose dog this is?" And of course, if you live in our neighborhood, you absolutely know whose dog this is. So it was hilarious that the dog had made it on campus, because like the campus is locked, but the church isn't.
Right.
And so like you can go like call in, and the dog was in the fountain.
So cute.
It was precious.
We have our St. George basketball tournament this weekend.
Ooh.
So I'll be living at the basketball gym, and it's camo themed, and they black out the lights, and
It's like a thing.
it's a big thing.
Is it like
And
glow
they
ball?
no, it's just the intro. Like
It's
at
just
the
the
LSU games, they like announce the players.
The music going and smoke?
fun.
Oh, the smoke
Really?
and the
Oh, I
It's
love
fun.
that.
so
Walkout
There-
songs?
walkout songs.
Do any
So
of your
good.
girls play basketball?
Mhm.
I can't wait. Like I am
So fun.
third grade is like when they get to start playing
Yes.
basketball at school, and Cecile's going to third grade next year. I'm like, yeah.
Yep.
She's like, I really want to play basketball.
So good.
I want like school sports.
My wife so wanted my girl to play basketball, like so much so that none of us play basketball, but she made me put in a basketball goal. at the
No, we have
house.
one
And like,
for Josh.
I'm not a basketball player. She's like, oh my God. And like every time, like my daughter's a huge dance, right? So every time there's like a small blip, like, you know, like something goes wrong with dance, you should have played basketball. You know, like You want to go play basketball? You want to try out for the team? I'm like, she's a sophomore in high school. You just don't
She's
pick up
a
high school
sophomore in high-
basketball. Like, it doesn't work that way.
I have like,
Did Elizabeth play
I
basketball?
was about to say,
Don't get her started. So
she was obviously a basketball star.
church basketball star.
Okay.
Nice.
Her
I get
church league she talks about all the time.
Basically,
Hey, back in the day, that was
WNBA.
accepted and normal. Not all these stupid competitive sports these days.
I hate competitive
I know.
sports. I just like to go and play, and it's fun.
Yep.
But
No
that's
more.
just not how it goes. Now I do like to win though. Like I still like to win.
Competitive. Yeah, that's good.
I still like to win, but I like for it to be fun.
Yeah.
I like for it to be fun. But I have like a super sporty daughter,
Mm-hmm.
and then one that's
It's
like
not super girly.
she only dances.
Right.
Like she's like, I shall dance and nothing else.
Right.
And I was like, oh, okay,
my,
great.
my girl's very girly.
And then I've got like the soccer tennis girl on this side.
So I do watch a lot of podcasting. They were talking about, do you think there's a generational shift amongst parents? Like maybe like certainly my generation and maybe like somebody yours, like we wanted our kids to like, we kind of put ourselves and like push them, like they call it the Tiger Woods generation, where like, you know, you start at 3 years old and like, you're going to play this sport and you're going to be this phenom. And now like, you know, they were interviewing some current or finishing up NFL guys. They're like, oh, I don't really care what my kids do. You think it's changing or no?
I think it's
Getting less. I feel like there was just like maximality or maximum.
Yeah.
Like my age group pushed their kids so hard, right?
it's not changing yet. I wish it would.
Okay. You don't think it's changing?
Do you know in our house, and like I was not a sporty, I was the dancer.
Right.
And for me, always, you know, dance was year round.
Right.
It's just year round. You get the summers off, not really, but that's like,
Not anymore.
yeah, I'm like, that's what it was. And then we would like fun dance during the
Right.
summer. And of course, you know, Josh was sports are sports. And as he goes up, and now his biggest thing for the kids now is like Cecile's like, I want to play soccer. And he's like, okay, you can play soccer during soccer season. He was like, you do not play.
Well, then maybe.
He was like,
I mean,
you do not play
maybe it
soccer
is
year
changing.
round. He was like,
I don't
because
know.
by the time that you're 10, you're going to hate soccer.
Okay, that's the key. That's what I was going to
Well, like,
say.
even like, you know, orthopedic surgeons are saying, hey, look, you cannot play these
Yeah, your
sports
body-
That's
year
right.
round. As a kid, it's altering or creating problems.
Yeah.
So I think it's maybe somewhat. I don't know. I'm not in it anymore, so I don't know. I'm just asking.
Josh's thing is like, there's a season. There's
Yeah,
a
I agree.
season for each sport.
There's a season
and
for a
he's
reason.
like,
There
and
is.
he was like, and let's say that she wants to get into basketball. Like if she wants to get into basketball, he's like, well, basketball is opposite of soccer. He was like, and so if she plays soccer year round, how do we know that she's not going to absolutely adore
Love.
basketball?
Yeah.
Because we're never giving her the opportunity because she can't do it because she's involved in soccer.
Yeah.
And
yeah.
he was like, I think that when they're young like this, they need to try and do because they don't know what they like. And like we tried T-ball for a hot second. And both of my kids were like, absolutely.
No.
You wanted me to
Yeah.
stand in the sun? It's going to be a hard pass for
Yeah.
me. Thanks. And so, but like, and I think we got to get back to that, like
Yeah.
the trying the
Yeah,
different,
truly.
trying the different sports and stuff.
I wish I would have had like big red lipstick or something today to talk about lips.
I wanted you to do my lip filler on the podcast.
Hello.
Okay. So we're going to talk about lips because guess what's coming up? V-Day.
Valentine's Day.
Valentine's is coming.
And everybody
but
wants
lips
to.
are a daily in our life. I mean, we
Yeah.
talk
Lips are
and
huge.
deal with lips literally every single day.
And it's kind
of
of
our
weird because
lives.
like lips have become just another, like, you know, I think lips were a hotly talked about topic maybe 10 years ago when we first started putting filler in lips. And now it's just standard. It's not
Oh,
even
100%.
it's not even controversial.
Do you know what I think about lip filler though? The same way you talk about boobs, how they go big and small and
Mhm.
big depending on like where it's at. I feel like lips kind of follow the same thing. Like if people like a lot of people get bigger, plumpier lips, and then it's like no, not so much. I feel like lips kind of go like
Okay,
that too.
I will say 5 years ago, it was a huge lip theme, like big.
Bigger is better.
And now I
Yeah.
will thankfully say it is kind of transitioned to a more natural,
I agree.
enhanced look rather than completely fake and
Filled
gigantic.
like to the brim.
which
I think
is
it's
a good thing.
matured. I think it's matured,
Yeah.
right?
Yeah, yeah.
And I still think it's like everything else, all fashions, you know, big boobs come in, big boobs
Yeah,
go out,
yeah.
big boobs come back, they
Yeah.
go out. You know, like But I still think always like big, full lips will always. I mean, you look back, I was scrolling cable or something, and it was Weird Science. I don't know if you all remember Kelly LeBrock. I mean, she was known for her giant, big, and that was all natural back in the day, right? So lips are hugely important, and you don't realize how many ladies have augmented lips these days, right? If you look back in movies from the 70s and 80s, 90% of these movie stars had kind of thin lips, right? And the really the Kelly LeBrocks and the really famous ladies were known for their giant lips. And now universally, you can't have thin lips and be in Hollywood.
No, because it's like, where's your lip?
Where's your lip?
Where's your lip?
So it's a degree like you talked about.
But before we get started with this entire conversation, how we typically bring an expert on, today we don't have somebody extra joining us because we have our resident expert. Miss Taylor Besh,
I'll
lip
talk about
queen.
Lip filler and lip flips, and we're going to talk about lip lifts as well.
Surgery
He's going to do something. But her.
The lip queen.
The lip queen.
You made.
The absolute lip queen.
I'll never forget. So Taylor, we live in South Louisiana, and me and Taylor have been together for a long time. We just got started on our practice. It was like 12, 15 years ago. And Taylor got known for doing lips, right? So me and my wife, I don't live in the French Quarter, but we were in the French Quarter, and we were walking around looking for gas lanterns. Long story. So we're looking for gas lanterns.
Do tell.
And
I feel like it's a good story.
This lady, the customer service lady walks up to us, and she starts talking to me. She's asking me, I'm like, oh, hey, John, what do you do? I'm like, hey, I'm a plastic surgeon. She's like, oh, is it Dr. Weiler's clinic? I'm like, oh, yeah. She's like, do you know you have a lady named Taylor Besh?
The famous Taylor Besh.
She's like, Taylor does all the girls in the French Quarter's lips.
What did you? I'm sorry.
She would get
we were doing
the girls. So we would get, and this is when me and Taylor just started. We were in Hammond, and all the ladies that danced at night would show up in our office. And this is back when like yoga pants.
He is. So
These ladies would show up with yoga shorts on. And they'd all have these big wads of cash. They come in like groups. They caravan up like 4 to 6 of them.
I remember one paid with, so fillers about $500. So it used to be $575 a gazillion years ago. $1
bills.
Yeah, $1 bills. They'd roll out a big wad of $1 bills.
I was so unaware that you were so famous.
And Taylor is like the most modest,
great
and just.
I did
get
not
carfuls of ladies that dance at night up in there.
And
they'd be
we were talking about
lobby.
a different dancing
but
in the earlier moments of this episode.
Some of them were like literally amazing people.
Yeah, no, they're great people.
Supporting their families
and
doing what they have to do.
I don't care what you. I'm just dying that you had like.
They call themselves midnight ballerinas.
Midnight ballerinas. But that's what you were, the midnight ballerina
of the French Quarter.
Of the French Quarter. Not just anywhere, of the French Quarter.
I mean, this was a lady working in the French Quarter, had nothing to do with the midnight ballerinas, that knew all the midnight ballerinas, that knew of her. Which is even crazier.
Wait, Taylor, this is amazing. Why is this not on your business card?
Okay. But I don't.
You don't do as much of that anymore.
Yeah, no.
She's gotten out of that a little bit because she's like, not that those, but Taylor's like got into.
Your midnight ballerina, did they follow you to Baton Rouge when you moved?
No.
No.
Aww. I really don't do a lot of it anymore. But he is right. Probably 14 years ago, that was true.
That was true. It was.
And you were the lip filler queen of the French Quarter.
She was.
I love it. Not in the French Quarter. No. We didn't practice in the French Quarter.
Yeah.
They would drive to Hammond.
Oh, yeah, Hammond. It was crazy. Hammond was pretty close. Like 35-minute drive.
And
they would come in like, they would all carpool together.
That's
so we get one.
Because they're economical.
4 to 6 at the same time. It was funny.
Chase, can you make them change the subject?
Wait, absolutely not. This is fantastic. So, expert. Was that like a voluminous?
That was like right when it was like
lip.
Okay,
really taking off.
I will say that it was very filled, very new,
and it was kind of controversial.
Correct.
It was kind of controversial. A lot of ladies like, oh, I'd never do that. Now it's standard. That's my point.
Everybody.
Now it's like everybody gets lip filler.
What do you have in your lips?
I have Juvederm Velour and Juvederm Volbella.
I have Volbella.
Yeah.
So talk to us about, since we go back 15 years to this, about the evolution a little bit of lip filler.
Yeah.
Does that make sense? Because you really were when it was starting.
There are tons of different lip or fillers that can go into a lip.
Mm-hmm.
We started off very basic and it has progressed through the years to have a little bit more advanced, smoother fillers. So I say back in the day, 14 years ago, there were, all of it has been hyaluronic acid, but there's different types of hyaluronic acid. And we started with pretty much Juvederm Ultra and Restylane L. That were like our two standards. And that is just a very normal size molecule, very structural, but nothing like crazy, just kind of middle of the road.
Nothing tailored specifically for lips.
Not structured.
Yes,
like,
correct.
Not cheap.
Not structured.
Yeah, like
just
not,
a very normal, natural-ish. I mean, you could put more lip filler. But as it has evolved through the years, there are newer products that are, it's a tighter cross-linking with a smaller molecule that makes it just kind of, I would say, fluid or soft.
Yeah, a little more viscous, a little bit more relaxed, a little bit more natural.
That moves better with the lip. That is smoother, softer, more natural, but still have some volume. So I always say there's stair steps. You can go from the newer products, Juvederm, Volbella, Velour, Restylane, Kiss, still Juvederm Ultra, Juvederm Ultra Plus, Restylane. There's stair stepping all the way up to Volux, which is actually a structural jawline filler that can go in the lip to give dramatic volume. So you have all spectrums.
I didn't know you could put Volux in the lip.
Yes.
Yeah.
I didn't
all
know that.
spectrums now, that it makes it really nice for us as injectors to be able to say, this is the perfect fit for you, because truly you pick the specific product per lip, per patient. Now, what the outcome that they're wanting to achieve, you have to consider, and their lip structure, their lip anatomy.
Can they handle it?
Yes.
Can their lip handle it?
Talk to us a little bit about lip anatomy. When you look at somebody, what do you go through?
So I always say that the lip should enhance the face, not kind of
dominate, right?
Distract
Distract
the
is a good
lower
word.
part of the face.
Yep.
I do think that there's the perfect proportions that he always gives a good description of the thirds.
Yep.
That the lip anatomy is supposed to be a beautiful asset. And so the Cupid's bow right in the middle is supposed to have a good proportion between the nose and the Cupid's bow, and that little philtral column area through here. And then the vermilion border should be very nice and soft, but prominent.
Define those terms. So philtral columns are the little lines that go up and down.
Correct.
These guys, right?
Yeah. Cupid's bow is right here in the
little-
center.
The
of
little
the mouth,
sweetheart right in the middle.
right?
And then the border.
The vermilion border is the border of the lip, that little wet to dry area right there. And then there's different things that you have to also consider with the perioral lines, which are lines around the lip.
As you age.
Smoker lines.
Yeah.
Volume loss as you age. A weaker bone structure, so you get longer here. And so that long top lip, if you can support the lip, it can actually shorten that distance. And we'll talk about lip lifts as well in a little bit. But the lip anatomy and the actual lip aging, I think, is different for everybody.
Correct.
But also kind of the same thing happens. Talk about your thirds.
Well, I mean, I always say,
And the projection of like the nose, lower lip, and chin. That.
yeah. So you always think of the face as 1/3, right? Middle, upper 1/3, middle 1/3, lower 1/3. There's some really good lectures you can look at online that talk about the concept of pi, like 1 to 1.6 ratios. So some people debate about the ratio of a lip. So 1 to 1.6. So one up here, 1.6 down here, or 1 to 2, as we've kind of enhanced our lips, right? There's some measurements that people talk about from the base of the nose to the lip, anywhere between 11, 12, 13 millimeters. But everybody's face is built a little bit differently.
So wait, is that
That's the distance
the
from the base.
standard or like the?
Well, there's measurements out there. So there are like measurements that, you do a series, you bring in a couple thousand people and you measure the ideal distance, right? And so, but I always say those numbers in my mind don't really, I never whip out a ruler and measure.
And like,
But some people
it's
do.
really
But some
just like
people-
what's
Some people do.
functional.
Yeah.
Some people do. Some people will come in and say, oh, they'll measure your lip and say, oh, your upper lip is too long. It's 16 millimeters. It needs to be shortened. I kind of started my practice with that, where especially on the breast, Like I would do all these measurements and like adhere to measurements. And sometimes I wouldn't get the results that I wanted to. And so now I threw the measurements out and I kind of just go.
More of an art.
It's more of an art.
Truly.
And I think the lip is more of an art. Now I do think there are ratios. So you have to look and it has to be balanced.
Yeah.
Right. And so if you look at somebody and their upper 2/3 of their face is in proportion, but the lower 2/3 is not, then it looks really weird, right?
Yeah.
And that's where you do like chin implants or chin filler, or enhance the lips. You know, like Taylor said, support the lips if it's too long. So there are certainly ideal measurements. And if you look at movie stars or people that are considered classically beautiful, they probably adhere to those measurements, right? But I don't think that you necessarily should whip out a ruler and measure. I don't. I think it's more about, that's where the artistry comes in.
Yes.
And I think that's where you can get really fantastic results. You can be sort of a woodworker and measure and all this stuff, but if you want to get a little more artistic, you have to use your eye a little bit.
Yeah.
more.
And I think it played its part early on.
Agreed.
Doing this. I mean,
Agreed.
yeah, us measuring and, you know, there's all kinds of silly little techniques that trend
Right.
where
Yeah.
it used to be the dental floss.
The
and they'd
line.
put it in, and they'd put a little
Yeah.
dental floss here, and
make it like
I
puffy on
mean,
both sides.
it's trends.
But
you know,
talk to us. All right. So let's talk about, let's work our way through. So let's start with a quick lip flip. So let's kind of work our way through ages. You want to do that?
okay, so a lip flip is the perfect starting point into the lip world, I always say. A lip flip is with a product called Botox cosmetic that everybody's heard, or any type of neuromodulator. And so what happens is there is a circular muscle around your mouth, and that circular muscle can cause some little pleating or accordion lines over the years, and that can form smoker lines.
Okay.
So if you have that and you want a little improvement, a lip flip is a good place to start. But it also has kind of taken off in the younger generation of just starting out in the lip arena. And so they want a little bit more show of their lip whenever they smile, but they're not ready for lip filler. A lip flip is the easiest procedure. You come in, we put a drop of Botox above each side of the upper lip. It actually relaxes that circular muscle, your orbicularis or oris muscle right here. And when you smile and animate, it allows your actual show of your lip, the red part of your lip,
The red part of the lip.
to
is showing.
roll
part.
back.
Right.
If you're at rest, you see nothing.
Right.
No difference. But when you smile and animate, I always do this.
Talk
I always
when
say,
you're talking,
yes,
when you're animated.
yes. With any animation, you see that it rolls back.
Right.
I always use that little.
Right.
Every time we talk about lips, it's the video of us talking about lips that makes it so funny. We're always like, and it rolls.
Yes.
And it just
Yes.
rolls back.
So a lip flip, very easy, $120,
And
and
it
it lasts for about 8 to 10 weeks. That is the only, part. You come in and see me more regularly.
Right.
Because you move and animate, right? And so that product metabolizes a little bit quicker. It is a little funny feeling, right? Whenever it kicks in. So pursing your lips, sucking through a straw, drinking out of a
Brushing your
wine
teeth.
glass, brushing your teeth, gargling your toothpaste.
Yeah.
I always say that will feel a little funny for about 5 to 7 days. And you're going to be like, oh my gosh, Taylor, what'd you do?
Yeah.
That will pass. And that is on purpose. It is relaxing that upper lip muscle that you rely on and allowing that lip to kind of have a little bit more mobility.
So for our young ladies, it's an excellent idea because it's showing more of the red, right? Which in terms, if you let's talk about like animal instincts, makes it a little bit more attractive. You're showing more attractiveness by showing more red.
It's that plumpness.
That plumpness.
Yeah, we talk about that, like
right? that
moisture.
I'm more fertile.
Yeah.
I'm more
Yeah,
attractive. I'm more
That's
fertile.
good.
Also for ladies that have these lip lines, right? It's going to help. So that's our older patients,
Yep.
right? And then talk about gummy smile. real
Okay,
quick.
so that's what
I
I
was
was
about
going
to
to
say,
say.
but
Yep.
before we get to gummy style, don't you also use it for like tiny lips to get more?
Yes. So if a patient
it's-
comes
I don't-
in and they have a very tight muscle and they want lip filler and their lip is like this, there's no place to put the lip filler. The lip flip helps me create surface area to place the product.
Yes.
Yes. So 3 different candidates: young patients who want a little bit more show when they smile and they want to just kind of start off with this, or it's a budget thing or whatever that may be. an older patient with perioral lines, those little vertical lip lines, helps with that. And also a very tiny lip who wants an enhanced lip, and the lip flip helps me place lip filler in there. Now, if somebody comes in and they smile like this and all of their gums show.
And when she says like this, she means like when the lip pulls up and the gum starts to show for everyone listening and not looking.
Yes. Okay. Yeah. So that is a very easy procedure as well with Botox Cosmetic, and it's placed in your LSAM muscle right here on the corners of your nose. It's just a drop and a drop, and that muscle usually pulls up here, and so that little drop of Botox just allows it to relax. So when you smile, it's not pulling that entire lip up. It is just helping it kind of soften and settle. Yeah. That does not feel funny. It lasts for about the same amount of time. And I will say with maintenance, we will improve it for long term.
Yeah. You will weaken that. You will beat that muscle down.
Yes.
Well, we always talk about it. It's the workout, and then you're not working out, so that muscle is not going to build.
Weakens.
And a gummy smile it's a huge difference.
Yes,
between
truly.
a gummy smile and a non-gummy smile on the same lady.
Yes.
Because a gummy smile is really unattractive.
Yeah. Yeah.
It really is.
Because it changes proportions. He's not being ugly. He's serious. It changes the proportions.
It is. It's
I get Botox in my I get it because like when I smile, like my lips pull up, and so I get the
what it is that it's something that throws the proportions out dramatically with animation.
Yes. Mm-hmm.
And so like, you're talking to a lady and they look attractive, all of a sudden they smile and like, oh my goodness.
Yeah.
It just throws everything off. So if you get rid of that, it's a big difference.
I would say the game changers addressing the lip addressing the smile that is not lip filler is gummy smile and chin projection.
Yes.
And if you enhance both of those without even touching the lip, it complements that area and the proportions.
Because it's balancing your proportions.
You may not have to touch the lips. Because,
truly, yes, it's beautiful. Absolutely beautiful. Yeah. So that's a lip flip. Lip filler.
And those are all toxins, Botox.
Yeah, those are your neurotoxins.
Not filler. You're not adding any volume.
Correct.
Talk about adding volume.
Okay, yes. So we want to step it up a notch. Maybe you've done a lip flip and you're like, loved it, didn't last that long. I want the next step. Yeah. You can combine lip filler with a lip flip, or you can just do lip filler, depending on the patient. And like we said, every lip is different. So we are going to have you come in, numb the lip with topical numbing medicine for about 15, 20 minutes. Cleanse the skin. It is I'll call it sterile procedure. So meaning you just have to cleanse the inside of the mouth, the outside of the lips, and keep it clean that day. The process then is we inject small aliquots of product to enhance the lip area. And that can be from, like we were talking about, a very smooth, soft, natural product all the way up to a very strong, bulky product. And it is, I would say every technique is different because you're trying to enhance different things on every lip. But it is beautiful to have an enhanced Cupid's bow and then kind of tailor that sweetheart look out to the side. I do like the bottom lip to be a little bit bigger than the top just because of, once again, proportions.
The ratio.
Yes, the ratio.
And it's the princess pout.
Yes.
Yeah.
Yes. And I always say respect the lip. So a lip can hold so much product at one time. And then it could go bad, meaning if you put too much or the wrong product or whatever, it can go out of the lip. And that's what we'll get to.
It can migrate.
Yeah.
But with the lip filler, so you are, and I think it's very important, like and I don't know if you heard Taylor and I say earlier, like she has velour and Volbella, I think you said in yours. I have Volbella in mine, which
are
some more.
Both very smooth, soft, natural, beautiful products that are not overdone.
But no lip is the same. No lip is the same, which is why I think it's so important to go to like expert injectors to make sure that they're assessing your lip for, like Taylor said, what can your lip handle? What are your goals? What are you trying to do?
Yeah.
Because like you said, there's a huge array of different fillers that you can put in. So it's like
another thing, he always talks about symmetry. That symmetry is beautiful if the face is symmetric. And a lot of times lips are very asymmetric. And so whenever you can enhance one side to meet that other side, it is amazing the difference. It will change the entire face if you can balance that. Now, with lip filler, so it's a very easy process. Come in, get injected. You can have a little bit of bruising and swelling present for a couple days after.
It's a journey.
And I'll always say you
journey.
have to trust the process. I put more lip filler on this side on purpose to match this side. This side is going to be a little bit fuller and bigger because there was more, trauma associated to the lip. And so trust the process. But once that lip has settled and softened, it is absolutely beautiful for 6 to 9 months.
And how long does it take for it to settle and soften?
What you said, I see patients back at 2 weeks. So I would say a week to 2 weeks is when it's truly
kind of gets back to that normal.
Yes.
I will say, so the first time that I gotten lip filler, day 2, it's a wild day. So just go ahead and accept that it's going to be a wild day. Everybody's the day after.
I used to get all the calls. Oh my God, what happened?
Yeah, like
stuck by a bee.
But like Taylor said, just trust. It's going to go down. It's going to go down, but it's going to be very prominent. The day
I have talked to patients in the middle of the night.
Oh yeah,
the day that they're injected.
It swells quickly and it goes down quickly.
Yeah.
But I do, like you said. I mean, by day 3, you're headed down. Like I feel like you're headed down. Like, I think
the day after. I mean, the next morning, boop, they popped up big, and then they go down very quickly.
And then they start kind of making that trek back down.
And I always say respect the lip. I mean, that's what we keep going back to. You want to enhance the lip beautifully. Respect the actual lip that you're injecting, and it will complement their entire face.
Would you say the lips are one of the more difficult areas to inject?
Absolutely.
Or get correct? I think it's
absolutely.
It's not fixated, right? It's not like your cheek area.
Correct.
Yeah.
It's not your temple area. It's not fixated to bone. You've got a combination of muscles, of sensory tissues. The lip is prone to swell. Lip. It's an area that has exquisite structure to it. I always say, like Taylor said, so first goal is symmetry, second goal is definition or enhancement of the structures, and then third is always volume or size. And I think if you follow those rules and know your technique, you can build a very nice lip. You have to always keep in mind the proportions, right? Upper to lower. You can't ignore the lower lip. Early in the process, people were ignoring the upper lip. I mean, the lower lip.
The lower,
and you were getting these giant upper lips with these tiny little lower lips. And we still see it. But lips are a skill that I think you develop with time. And you have to have an artistic eye. You really do.
It's an art. And I think everybody uses a different paintbrush.
Yeah.
Right.
And I think that that, like you said, they're so important because it is something. And it's that, like pulls you in.
I want to say something. I think the thing that, especially my generation or older, that keeps people away from lip enhancement is fear.
Right?
Oh, yeah. Oh.
It's fear of looking.
Everybody thinks that they're going to be like,
they're going to look like
they're going to have the big old ducklet, like.
Well, and they'll come in and want their perioral lines fixed and me to not touch their lip. And I'm like, we can't do that.
The same. We got to do it together.
Yeah. And they trust the process. And we do fix their perioral lines by a little bit of volume in the lip.
Have you ever seen the First Wives Club?
And the oh my gosh.
With
Goldie Hawn.
Goldie Hawn.
So good.
I love her. Diane Keaton. Oh.
Speaking of older patients, and sometimes but the upper lip gets longer. And so we're going to go to commercial break. But after, I want to talk to Dr. Weiler about lip lifts, which is a surgical procedure that is amazing.
But aren't you using filler to, didn't you say that
you absolutely can build. Yes, your filtral columns, which can shorten the upper lip. But there's a time where a lip lift is necessary.
Just like we say, we can put filler in all day, but you're going to need a facelift.
Correct.
I think with everything that we do, it's there's levels. So we are going to take a break. And then after that break, we're going to get Dr. Weiler to kind of give us, the full rundown on lip lifts.
Yep.
Yeah.
Yep.
So hang tight. We'll be right back.
My name is Heather Robertson. I'm from Ponchatoula, Louisiana. I just recently turned 52, and I just didn't want to look like I turned 52. I have daughter-in-laws, I have daughters, we all go to the beach, and I just felt so uncomfortable, like in my bathing suit, because I had so much loose skin. Dr. Hogan and I talked about it. We did an arm lift on both of my arms. I'm so happy with the results. Don't hesitate. Step in and go for it, and just be a new you.
My name is Josh Hughes. I'm 43. I'm currently on the HRT program. I just started feeling the effects of getting older, being tired all the time, not motivated, sore when I would do physical activity, and just needed a change. I've been on the HRT program for around 3 years. Within the first month, I completely noticed a huge difference in my mood and energy. The weight that I had gained started to drop off rapidly. It just gave me a new lease on life. It made me feel like I was in my 20s again.
All right, welcome back. And now we're going to we're going to the next level. Obviously, we've talked about the neurotoxin in the lip, the filler in the lip, and now we have we've done that. Still haven't. Now we're headed over to lip lifts. Now we're into the surgical realm of this. And like I said before the break, this is like one of those things you can put filler in something all day, but in your face, you need a facelift. So this is what we're talking about when we're like the elongating area above the lip.
I want to know why. Is that just a natural genetic? Why is it because of bone resorption here? Does it get worse and longer as I know?
And we have our
does.
expert, Dr. Weiler.
Yeah, I think it's a skin tone and texture, volume, right? You lose muscle, you lose fat, you lose soft tissue. You also lose bone, especially in the midface. So you throw all those things together, and some ladies, like we said, they may have had a little bit of a longer lip to begin with, and then that little bit of a longer lip gets a lot longer as they age.
Yeah.
And this is just when we talk about longer lips, this is like from your nose to the top of your lip.
Basically from the nares, right?
Yes.
The openings, right? Or that little columella right here where it joins the lip, and to the measurement of the red-white roll.
Your mustache area.
Your mustache area. Yeah, mustaches are big these days. And so that can lengthen over time. And I do think there's lots of little tricks and tidbits to talk about real quick. And then there is a surgical option for that. When you look, at a lip, we talked about numbers early on in the podcast. And there are some numbers, whether it's 11, 12 to 13 millimeters of length. I am not a numbers guy, so I don't adhere. But, if you're way outside of that, yes, you probably do need a lip lift. You also want a good red show, right? So, the vermilion border is the area right where it goes from white to red. You have the dry red portion and the wet red portion. And so, seeing a little bit, you want to have a good dry red show, and you want to have just a little bit of a wet roll, they call it. You want to have more red show here, centrally, than you do laterally, right?
So what you mean, more red show in the middle?
In the middle.
And then...
Right. You don't want like a ton of red show
on the outside.
On the outside, because that looks
closer
really...
to like the corner of your mouth.
Correct.
Which a lot of girls want, and it's not a good look, because then you develop these little wrinkles right on the corner here. A natural, beautiful lip is to have most of your volume at the top, and it naturally transitions
tapers down.
Yeah.
Right. And what happens is because you're having a little bit of wet show right here, you do have to touch your lip a little bit with your tongue. But you don't want a lot of wet show out here, because then you're licking
because then you're licking the
then
corner
you're
of your
licking
mouth.
laterally in your mouth, right?
And
good. So you don't want to have your tongue flicking all the way across your upper lip. And a bad lip job is a lot of wet show all the way across your lip. And then you're taking your tongue and you're going all the way across your lip. It's not good. Because ideally, if you look at, these ideal lips in the world, you also have a little bit of incisor teeth show. So like you have a very nice central lip, because at repose, which means when you're relaxed, you want to have a little bit of tooth show.
Oh, okay.
So like Brigitte Bardot was famous for that. So if you look, Brigitte Bardot, who recently passed away, if you look at her pictures of her, and even later in life because of her structure, you look at her in her 20s and 30s, she had a very, very pouty lip. And obviously this is way before lip fillers.
Right.
Had a very full lip, but she also had show of teeth. And so ideally, some ladies that are considered very attractive, have white show right here at repose, at rest.
My lips don't touch. Yeah.
They don't.
Wait, why don't my lips touch?
Right. They're not really supposed to touch. Ideally, you want to have a non-touching lip right there, essentially. So you do have to kind of keep that wet. You want to have that wet show in the middle. And that just goes back to, animal instincts.
Yeah.
It goes reproductivity, all those things, I'm not gonna get weird, but
You look fertile.
Yeah, you look fertile.
Fertile
right?
myrtle.
So a little bit of wetness in the middle is fertile. And so there are procedures called a lip lift.
Okay.
Where you are shortening the length of the upper lip. It can be done under an anesthesia, it can be done under a local, where we are physically removing full thickness skin all the way down to the muscular layer right below the level of the nose.
I feel like it's a tummy tuck for your nose. Like in
a
that
reverse tummy tuck.
a
'Cause
reverse
the tummy
tummy
tuck's
tuck.
going down.
Yeah,
Yes.
you're pulling down, but you're doing a reverse tummy tuck
We're
and pulling
it
up.
Yep.
We're pulling it up. So what we're trying to do is we're trying to shorten the distance of the lip. You're trying to get a little bit more red show.
Mm-hmm.
You are rolling the lip just a bit. And ideally, if you can, you would love to get a little bit of tooth show.
Is this for a older, like the older generation or do you find this like sometimes it's just anatomy, how people are born?
It's a little bit of both. It can be done.
I was going to say both.
Yeah,
Is
it can be done at a younger age. If you're born with a naturally longer lip,
Mm-hmm.
it can be done if you want to try to show a little bit more of a white show
Mm-hmm.
and try to shorten your lip. You don't want to shorten the lip beyond the normal barriers.
Yeah, because
So if you have that 11 to 13 lip or you have a proportionate lip, it's not a good idea to come in and get
That's
a
not
lip
for you.
lift. It's not for you.
because then your mouth's not gonna.
It's going to throw your proportions
Yeah.
off,
Mhm.
right? And so then that's where you go for filler. And that's why most ladies are going for filler at that age. If your lip length lengthens over as you age, so it is done occasionally in our younger patients. It's more often an older patient
Yeah.
procedure.
What type of recovery is associated with
Yeah.
it? Like,
So the
Is it, like,
problem
tight and everything?
the problem I see with lip lifts, and I do them, I do quite a few, is the scar, right? So it's an incision.
Yeah.
And remember, anytime you make an incision, you will have a scar. Whether that scar is noticeable or not is dependent on a lot of factors. How your body heals,
Your skin.
tone and texture, who your surgeon is. But there will be a scar. And that scar ideally is in that little crease, but it does cross all the way across. So in some ladies, that's a no-go. And some ladies who wear a lot of makeup or who have certain types and textures of skin, it's an excellent idea.
yeah,
But I always tell ladies,
He always talks to them about
the scar. Because it's
about
once
the
it's done, it's
scar.
permanent.
and it's on your face. Like
Yeah.
I feel
Yeah.
like people are
and
very.
it's not like a facelift scar. It's not like a blepharoplasty scar. Eyes, I do blepharoplasties. I do a ton of blepharoplasties, and I do them with abandon because it's almost impossible to scar
Yeah.
poorly on the
They're
eyes.
hidden.
Right. Facelifts, it's hidden very well, and it's
Yeah.
on the side. The problem is the scar is central. It's right there, and it's people you focus on eyes and mouth,
Yep.
right? And so it is something that's you do have to think about. I wouldn't necessarily compare it to arm lift scars, brachioplasty scars.
Yeah.
That's a big step, and but it's one of the surgeries that I really do say, hey, let's talk about the scar.
Yeah.
But it can be a very nice procedure. I do tell ladies also, it's not a hugely dramatic. We're talking about millimeters. So we're not taking out half of your lip
No.
and pulling it up, right?
It is a slight.
Yeah. So there are limitations. And typically we're taking out 3 to 5 millimeters of lip length. And then we're pulling it up. Yep. Yeah. Because, we're talking through here. So I love it. I do it sometimes stand alone on our younger girls. Very often, though, it's combined with other procedures.
Is
to be
it
done.
combined with filler?
No. So I don't. There's nothing
Recommend?
wrong with filler.
I mean, you could come back and
You
do
could come
filler.
back.
Yeah,
and
I'm
do it.
sorry. I didn't mean it like the same time, but like,
Yes.
is this something that you could do and then enhance it further
that's a great
with
question.
filler?
So I am not. So usually when I'm doing surgeries, I like to do fat, which is the world's most natural filler because it's your body's own
Yes.
fat. They also have alloclay, which is we'll talk about in a future podcast, which is someone else's fat
Yes.
going into your body. But using fat, I am not a huge fan of fat in the lips still. I think of fat as structural, which means deeper. So what that means in my mind is, yes, I will put fat in the lips, but it's a deeper structural fill, which means it's not going to address the vertical lip lines.
It's more supportive.
It's more supportive. It's not going to define the vermilion border.
Yeah.
It's not going to give you so my first line for great lips is filler still. And then I will do structural fat grafting into the lips, but I will tell patients it's not going to define your vermilion border. It's not going to create a solution for your vertical lip lines. What it is going to do is add some bulk. It will support, possibly shorten that lip length distance, and we could do it in conjunction with a lip lift.
But he's putting the fat, once again, proportions all back here
correct.
to take the weight off of here.
Yeah.
Correct.
So it's all related.
We're structurally grafting the whole face.
Yeah.
I never structurally graft, just fat graft the lips.
Yes. I mean,
Yeah.
I think lips are so funny in a way that the slightest little change in them, like we said, like how
it's
it's a huge change.
Huge difference.
It's like the slightest thing, but you can tell, like you said, it's an art. It is
And
an
I'm
art.
going to say it's something men rarely notice. So we do a lot of ladies, and they'll be very fearful their husband may find
Oh, my
out, or
heavens.
they want their husband to notice. They're gonna their mind will register something.
Yeah.
If
but
they
they're not
didn't
gonna be like,
see
oh,
you
she
the
had her
day
lips
after,
done.
they'd be like, I never even knew.
Mhm.
I came home with cheek filler, and Josh, like the next day, was like,
Right.
and then just kind of like brushed it off. And then like at the end of the week, I was like, yeah, I got my cheeks done. He's like, oh,
Right.
okay. I was like, you don't see it now, do you?
Right.
He's like, no, I don't. It's like,
Right.
it's like they don't notice.
Yeah.
They're
Now, as a lady, your friends may notice your lip filler.
Correct.
But your
Yes.
significant other is rarely going to say, you got your lips done.
ugh.
Because men just don't register
No.
the cause and effect.
Yep.
They just don't.
It's the same way that I'm like, why
So,
didn't you notice that I cut my hair?
Lip lift sutures are
So they're very small. I do put some permanent and then some absorbable. So you will have those in place for around 5 days. The permanent sutures come out at that 5-day mark. The quick absorbable sutures will start to dissolve at that point. We
and
obviously
he
put
does that
deeper.
for scarring. Comes
scarring.
out quick for
We
scarring.
want to prevent any train track scarring, things like that. You will have a scar. We will treat that scar. We will talk about how to improve it.
Because there's all kinds of things.
There's all kinds of things. But no matter what we do, that scar will be a little red
Yeah.
for the first couple of weeks. It can be covered with makeup. Most patients scar very well in that area. But it will alter, it will certainly shorten, alter the appearance slightly, and you have to be accepting that you will have a scar. So, if you look,
I do have patients ask if it's going to pull down the nose.
No.
And that's
The base of the nose is very well fixed. We are fixating these sutures to the deeper structures of the nose, and we will not the lip is much more mobile, right?
Yeah.
And so the lip is going to move far before the nose moves. And we are limited by, that's why I said we can't take out half the lip, because then it would cause tension. Tension causes poor scarring, and it could slightly displace and elongate the nose. So there is limits to what we can do, but no, that will not move the base of the nose.
And that's why it's so important to have someone
Correct.
really take a look at it and, like I said, make
Right.
sure that you're appropriate candidate for it.
You're trying to shorten the lip, but you're not doing a lip lift. What are you doing?
You're adding volume to the lips. Is that what you're
Adding
saying?
volume.
Right.
You could do your your piriform here.
Do you about excision wise?
No.
Oh,
No, like you're
Just in general.
yes.
okay.
Injectable wise or fat grafting wise.
Yeah. So I would start with, to me, hey, if you've got a lip problem, then you obviously have a volume full face, right? And so if you wanted to do something, and let's say, you may need the facelift and then fat grafting, we recover from that. And then I send you over to Taylor, because we're going to bulk fill fat in the upper lip. We're going to graft into the malar cheek area. We will graft lateral aspects of the nose to support volume through there. And then you need to really get the fine paintbrush
Yep.
and work the details. So
Yeah, volume in his placement would shorten the lip without a lip lift.
correct.
Yeah.
Volume will shorten that lip just structurally, filling back up the volume that is lost will just fill.
Yeah.
And it will, therefore, it's like similar with breasts. You can fill the breast and lift it slightly. It's not going to, lift a nipple position way up, but it's going to bring those breasts back
Right.
to where they
Yeah.
want to be.
Right.
Well,
So
it's
you
the, it's
fill
the
lip.
gravity.
It's the
the
gravity.
gravity. Everything is like after you
Well,
lose that volume, it's going down. You're just replacing that volume to
Correct.
put it back up.
Volume is like air, right?
Yeah.
Balloons, when they deflate, they sag. You fill them back up and they revolumize. If you've still got good tone texture to your skin, then you will revolumize very nicely.
Yeah.
Yes.
If you got really crappy skin or you got too much skin, then we may have to talk about
Right.
a lip lift, right? And then you have to come back and you have to get that definition down
Yeah.
to get a pretty lip.
Yeah.
Right?
Come back and let Taylor sculpt it appropriately.
Yeah, and the importance of the filtral columns, those two little structural components here, are truly beautiful.
Beautiful.
Mhm.
Yeah.
Absolutely.
And for those of you that are
beautiful.
listening, those are the lines, the two
Those are-
parallel
yeah.
lines that run from the base of the nose to your Cupid's bow,
Yeah.
which is the central portion of your lip.
I think there's so many options for lips.
That's what I was going to say. I would say
So-
every lip is different. Every
Mhm.
lip needs something different.
Yeah.
And so it's just really, really important for us to see the lip and talk about expectations, what you're expecting, what we're,
Well,
there.
I want to end on this. All right. The message I tell, and I see, older ladies or ladies that are, that don't believe in filler, right? Is big lips doesn't equal beautiful lips, right?
No.
Don't be fearful of lip filler. The results can be dramatic. When I say dramatic, I mean subtle yet significant.
Mhm.
You don't have to just throw in a ton of filler
No.
and get this big old upper duck lip. And I think there was this misconception for ladies that, were in their 30s and 40s, 15, 20 years ago, back when fillers
Yeah.
were just coming out, and they saw the bad lips and they watched the First Wives Club and they saw all that
You're so
craziness.
right.
Everything.
And they're like, oh no,
Real
I'm not touching my
Housewives.
lips,
Mhm.
right?
That's what
Right.
it was.
Or and I still have, guys my age, 50s and 60s that are like, your wife does that, or like, well, you're not like, and my wife always says this all the time, men, they want their girlfriends to look good, but not their wives or something like that, and so, youthfulness is attractive and volume equals youth. So you have to maintain some volume
Yes.
to maintain
Right.
the appearance
Right.
of youth. There is no getting around. If you want pretty youthful lips, you're going to have to at some point add some volume.
Mhm.
There's other things we can do like lasering, surgery, but volume is the king in the lips.
Yep.
I feel like if it's done appropriately, I feel a lot of people are very shocked when
Absolutely.
when I tell them how many syringes
Yeah.
of filler I have in my face.
Yeah.
And I mean, I feel like they are truly shocked. They're like, no way. And I'm
Right.
like,
Yeah.
yes way. Like
Yeah.
I have quite a many in here.
Right.
And it's just because if it's done in an appropriate way,
Right.
if it's done by someone who is actually assessing the face and telling you like, no, your lips can't handle that. You
Yeah.
know, like having
Right.
that honest conversation with your patients and, making sure that the expectations are aligned on what their face can handle and what the proportions need and all that kind of stuff. I think that's so important.
Yeah, truly.
It's fear. Fear, I'm looking at the camera, is what keeps people from getting what they want. Right?
Absolutely.
So get over the fear.
Absolutely.
Go to somebody you trust.
Okay. Speaking of
Mhm.
getting over the fear, WPS has a little something coming
Oh,
around
yeah.
the corner regarding
Oh,
lips.
I thought you were talking about like Fear Factor or something.
I thought you were about to
This
strap
could be
me
your
down
fear
and do
factor.
something.
Speaking of fear, sign up for lip filler. No, but WPS has something coming up.
Yes.
We have a lip event that we do
Annual lip event.
once a
What is
year.
it?
It's
What
usually
is it?
around Valentine's Day.
To get your puckers
And it
right.
is a week-long event that it is February 2nd through 6th. And it is just
you're right.
discounts and fun themes.
Yep.
We do more affordable lip flips
Yep.
in conjunction to lip filler. And the lip filler savings is pretty significant.
Wait, this is the perfect time too for the time
Yeah.
frame of the
Perfection.
journey
Yes.
to be ready for Valentine's Day.
So if you really are considering the event or coming in for filler at all, we ask that there are no dental cleanings
Yes.
or immunizations 2 weeks before, 2 weeks after.
Mhm.
No makeup applied the day of after you're injected.
Mhm.
Stay away from blood thinners a couple days before. That is
Yep.
strictly for bruising and swelling. I mean, if you do, then, you just may have a little bit more downtime. And that is really it, honestly.
One other thing, throw out your fear.
Yes.
Yes.
Don't
Get
come
it out
in
of
with
there.
fear.
I'm not gonna lie. I was scared. I was so
Be a little
scared.
scared.
But
Be scared, but don't be fearful.
Yeah, like I was
That's
scared
true.
when I
Yeah.
was scared when I went because I was like, oh, what is this gonna do? What's it gonna look like? How's it gonna act? No, I absolutely loved it, and I had a whole syringe. Like we did an entire syringe,
Yeah.
and put that in my lips, and I was so happy after that I did it. No, I'm still scared. I mean, me and Taylor we are self-proclaimed.
Yeah, you can be
wussies,
a little
but-
scared of the discomfort, which
But I
is
think
not
that's
bad.
It's normal.
It's not.
No, it's
it
not.
wasn't. It was. I had built up so much like before going in, and then when I
Anxiety.
went in, I was like, oh,
Yeah.
okay,
It's
okay,
fine.
It's fine.
Don't be
It's
fearful
fine.
of your results. We're not going to lead
Yeah.
you. This is a great intro.
But this is why we say that you should absolutely get a trained injector.
Yes,
Consult.
truly.
Make sure that you get an
Right.
injector that is going to not just be like, oh,
Yeah.
look at you.
Don't get in the back of a salon.
Don't.
Right.
Don't. But yes, go
Yes,
to the
February
lip
2nd through
event.
6th is the lip event.
Go see Taylor, the French
We
Quarter.
have,
the
Lip
French
queen.
Quarter
French
Oh
Quarter
gosh,
queen.
let's not say
The
that.
French Quarter Queen. I am just like,
And
I
this will
can't-
be offered at all of our offices.
all locations.
Everybody is on board, and we're all so excited to see you.
Oh, there's so many locations
Yeah.
too. So
Yes.
anywhere, I mean, in South Louisiana,
Yep.
go find you a Weiler plastic surgery gal and get your lips ready for the Valentine's Day.
That's right.
All right. So now that we're gonna go ahead and head out of here, make sure that you subscribe to our YouTube channel.
Subscribe
below.
below.
Taylor and I want to win a Golden Globe, and make sure you do that. So like, subscribe. Make sure you're listening to us on whatever platform you find your podcast. Make sure you're following us on all those social platforms. Remember to always stay curious, always stay informed, and always consult before you cut. We'll see you guys next week.